Hi, good evening. Greeting of the day. My name is Dr. Monica Thakur, and I would like to first of all thank Dr. Reena Hyun for the invitation to speak on a topic of psycho-oncology, one of my research paper, which I'll be discussing briefly here. In case if you have any doubt further, you can post the comment on the video. So I'll start. So the topic which I have taken in 2019, actually I started this, post-traumatic growth and psychological distress among female breast cancer survivors in India, a cross-sectional study. And my team included Professor Dr. Rupali Sharma, Professor Dr. Anand Kumar Mishra, and Dr. Kulranjan Singh. Basically, in this particular study, what we have done, that we wanted to actually assess what is the post-traumatic growth among breast cancer survivors, since the treatment opportunities and advancement in the treatment is increasing, and a number of survivor that number is also increasing. So considering that increase in the number, it is very much essential that we study that what are the different problem, as well as what are the different kind of growth which is happening among the breast cancer survivors. So this particular study we have taken into consideration, where we focused on post-traumatic growth. Post-traumatic growth is basically what are the positive changes which can happen after a traumatic experience or any kind of adversity in the life. So post-traumatic growth include a major component like spiritual growth, appreciation of the life, new possibility, etc. So our study also included to take other particular associative variable like psychological distress, body image disturbance, and what are the different demographic and clinical profile which can affect the body image disturbances and post-traumatic growth, as well as psychological distress. So we here, I'll just focus on this particular picture. If you can see, in total we have taken 700 people who matched our study criteria, and then we put inclusion criteria. Inclusion criteria included women who were more than 60 years of age, who were diagnosed with breast cancer and then treated, and nearly 3 months of treatment was completed for them. So those particular women we have, so active treatment part was completed. So some of the women who could not meet the inclusion criteria were the women who were age 60 and above. Some of the people we couldn't find the phone number, and some of the people did not respond, and some very few did not give the consent for the study. And then out of those 700 people, 300 matches the inclusion criteria, and then we went further for the exclusion criteria. 118 subjects were excluded. Major reason was metastatic cancer, and then recurrent cancer and other medical morbidities like diabetes, hypertension, thyroid, etc. And in case if the person also have history of psychiatric illnesses, we have excluded those people also. And then finally 182 people were the one on whom we have applied various scale to assess our main study aim. And those tool was post-traumatic growth inventory, depression, anxiety, stress scale, and body image satisfaction scale. So uh, in these all particular patients, we this tool were applied on a very short period of time, since we have taken brief inventories as one of the legal concern, because legal and ethical concern that the person is already going through a lot through maybe treatment, maybe traveling and other things. So taking so much time is actually from that particular patient, person might get actually irritated. So in that particular scenario, it is much suggested and suitable also that we should apply the brief inventories for those particular people. So the basic outcome which came from our particular research study was, first we'll talk about depression, anxiety, and stress, and then post-traumatic growth inventory, and then body image disturbances. So as you can see, major component was post-traumatic growth. So the mean of our study was 37, which was actually a comparatively higher mean comparative to the other Asian studies. And in this particular domain, the subdomains having spiritual changes, personal strength, and appreciation of the life and relating to others, they were not having very high score, but comparatively these were the domain where our particular subject they scored more, while the new possibility domains had comparatively less mean score. When we talk about a psychological distress, we found that the mean score of the depression was 10.43, while anxiety it was 6.06, while stress it was 9.97. So this all score is having a cutoff, and then of course it have a severity. So this particular mean score inclined toward the mild severity of the disease. Although even they are breast cancer survivor, but still the mild severity is there. And in the body image patient, we have found the highest score is actually a 30. And in our particular subjects, what we have found that the subject had a mean score who are having modified radical mastectomy, and the breast cancer patient, breast conservative surgery patients. These people have a score of 18.40, while the people who were only having a mastectomy, and here actually we have taken people with bilateral mastectomy, those had comparatively higher score of 2 points, that is nearly 20. So we can say that there is a slight difference, although the difference is not very much, but of course the person who go through the mastectomy and the body disfigurement will be higher. So their body image score will be comparatively higher. That was speculation, and that's also supported by multiple evidence. So when we talk about the reasons behind these all things and what are the different kind of association, so when we talk about depression, the prevalence rate was for depression 29, 33.5 was for anxiety, and stress it was 25.25. So it again inclined toward the mild severity, but considering the mean score of nearly mild depression of among all the people, so that means the people suffer through the psychological distress, even though the person have gone through the treatment. So it's not only about that surviving, it's about uh, what the person have gone through, what are the different changes which has occurred. It might be just fresh awakening, and then person might realize that I have actually gone through these many things. So second domain, which was post traumatic growth, that particular domain had higher kind of what we say mean score in the domains of spiritual and personal strength. As you can see here, this was the mean score. And so what we see here actually in the previous studies also, post-traumatic growth comes out as one of the positive uh, outcome of the coping strategies. So previous studies also, even one of my study have suggested that the people somehow start believing in God, and they have that thought process that if God have given us the disease, so then God will only cure us. So it kind of give a hope to those people, and then when they come out of it, they become more thankful to the God. And since they become thankful to the God, at the same time coming out of that particular adversity make them also appreciate their life. Hence the score in the appreciation of life was comparatively more. And when we come and talk about the different strength of the individual, once person can come out of this big adversity, of course the personal strength of the person are realized, and then the person try to put more effort. while one of the outcome was comparatively lower in our study, which was new possibilities. So real reason for why it was low, because in many of the Western studies, if we see, the new possibility domain will be higher. So what is my speculation in this particular area is, although we cannot speculate in the research, but considering that my women, whom I have undertaken this study, they come from the rural demography, and their majority of them were not having more than 10th class education in their background, and their socio-economic background also was uh, comparatively poor, and even majority women were not working. So here, when these particular elements all come together, then the question is that they are not working and they didn't had any kind of career before. So now what to think new? If we are measuring the new possibility with respect to career or with respect to helping other people, then it becomes very much subjective, because it we also should consider that whether person was working before or not. So maybe new possibility for these kind of people, maybe just having an opportunity to live the normal life which they were living before the cancer. So that might be the new possibility. So I think new possibility is very much subjective to a person. What I can think of as a new opportunity, for some people new possibility might be a new career leap. For some people it might be, I'm working in the academic, I was doing a regular job, and now I need to maybe start my own career, or maybe I need to start an NGO to help the people. So it's again very much subjective. So if we are measuring these things with just two questions, then I think it restrict us and restrict the patient as well, that whether the growth is happening in this area or not. So I think that is the one of the reason that this actually kind of make the less score. But if we keep these kind of question as open ended or qualitative, then maybe the answer might be comparatively different. So when we speak about what are the things which were associated with post traumatic growth, so we have seen there was a negative kind of correlation with psychological distress, that is depression, anxiety and stress. So it suggests that the people who have higher kind of distress, those kind of people will have less post-traumatic growth, while the people having less depression, less anxiety and stress, those people will have higher post-traumatic growth score. While also it was observed that even the body image will be impacting that way. So we need to somehow inculcate the kind of coping, healthy coping specifically, in the patient with breast cancer or any kind of cancer, so that they can grow out from that particular disease with some positive outcome. And then also we have observed that clinical variable was also somehow related with post-traumatic growth, and the more the duration was the treatment, the more the post-traumatic growth was happening. So we can say the people who were the new survivor, like less than a year, those people had less post-traumatic growth. And the more the person was going with the survivorship year, so then they learn to cope up with the disease, and they learn to cope up with the fact that they have come out of it. So then the individual's post-traumatic growth was comparatively more higher. So this particular study have basically suggested in conclusion, what we can say, that many diseases and many adversities happen in the life, including cancer. So although there are many negative outcome out of it, but people somehow learn to live with this and learn to come out more stronger through the adversities. So what we need actually here, that one, psychological distress and body image disturbances, these kind of things suggest that we need to actually assess the patient not only during the treatment or at the time of diagnosis, but throughout, after the survivorship years also. And many people believe that now the person have survived, now what is the need of the therapy or the counseling or even the assessment. So 33% and 25-29% of the prevalence rate suggest that they are not out of it completely. So when a person go out of the disease or go out of the treatment, we should again put them either in the breast cancer or any cancer support group, whatever it is available in the particular help center. Otherwise, we can connect them with the older cancer survivor who are doing comparatively well and who have learned how to deal with this kind of things. And we need to again, this is again I focus in majority of my research and also in my talks, that we need to make individual specific tailored interventions for each particular one, based on from which socio-economic background they come from, what is their marital status, and how they are coping. So one of the limitation of this study was that I could not include in the demographic variable the number of children they were having, and whether they were having the children or not, because it is not a documented finding, but this is something I have observed, that majority of the patient who were somehow crying and somehow in the more distressful stage, those people actually had one of the concern that how the my children will be coping up with this, and what will happen to my children in case if I'll die. So that fear of death is something which we need to assess, and at the same time whether they are having children in the life or not, because the people will always have to think about it. So when we include these all component, we need to come up with one or other solution also for it, that how we need to see each patient, because each patient's problem might be differing at a various level. So this is the conclusion I have with this particular study. And one more line I would like to add in the end, that majority of the studies, whether at international level or at Indian level, is lacking the positive side of it, what comes after. So I think there are very less study among breast cancer survivor or cancer survivor who are having the component of post-traumatic growth. So we need to focus on this. This is quite a new area, and if we can study this on a larger particular scale, then generalization will be much better, because demography of India and other countries can vary. So the demography in our particular country is very much diverse. So if this study is of northern India, when we talk about the south Indian population, there the result might be totally different, because and the urban people, those people might have total different kind of post-traumatic growth, and while the rural people might have a total different kind of post-traumatic growth. So I think if they focus on the urban people and they focus on the other cancer and on the different demography and the region, then I think they can find some good result. Thank you very much.